I'm the Executive Director for NAMI Central Texas, and I am so excited to welcome you to Mind Matters at Home. This evening's webinar is Raise Your Voice, How to Advocate for Mental Health in 2021. We know that we're about to begin this, or we have begun already, this legislative session, and so we're so excited to have both Greg Hansch and Matthew Lovitt of NAMI Texas, and they're going to be walking us through how to be the best possible advocates during this really critical and important time. Welcome, Greg and Matthew. We're so excited to have you here, and we're going to turn it over to you.
Thank you so much for the warm introduction, Karen. We are really proud and really honored to be with you this evening with the NAMI Central Texas community. This is something that we've been looking forward to doing because it's so important that we engage with local NAMI affiliate organizations in partnership on advocacy efforts. And I would venture to say that it's especially important that we partner with NAMI Central Texas because of the unique position that the Austin area affiliate is in engaging in person at the Texas State Capitol. And we'll get into, what sort of opportunities are available when it comes to that form of advocacy in this legislative session. We're going to go ahead and share a PowerPoint. I'm going to introduce myself a little more, and Matthew will also introduce himself. Matthew is my co-presenter. I'll just tell you a little bit about myself and my role with NAMI Texas. I am the executive director of NAMI Texas. I've been in this role for a couple years. Prior to becoming an executive director, I was public policy director. So I've done presentations like this for NAMI Central Texas and before it became NAMI Central Texas, NAMI Austin, I think that this will be the 5th consecutive legislative session that I've done a presentation like this, going back all the way to 2013. And I would say we've made great strides in our advocacy efforts. We've accomplished a great deal, and much of that success is due to the engagement on advocacy of local NAMI affiliates. And it's really not just something that happens because of coordinated efforts on the state level. A lot of the success can be tied to what volunteers with NAMI Central Texas and other affiliates have done. So we appreciate that partnership and support. Matthew, would you go ahead and introduce yourself?
Absolutely. Good evening, everyone. My name is Matthew Lovitt. I am the Peer Policy Fellow with NAMI Texas. I am not as seasoned as Greg. I've been with NAMI Texas for about 8 months now, maybe 7 months. But Greg is a great mentor, and I've learned a lot in that short period of time. And I'm really excited to be here with you this evening and share some of those lessons and hopefully to inspire you to participate in the advocacy process this session.
Thanks, Matthew, and it is great working with you. You're a great member of our staff, and you just in that short period of time, 7 or 8 months, have really contributed a great deal to the advocacy work that we're doing, and I think we're going to achieve a lot in this current legislative session. So just for a little bit of background about NAMI Texas, I know by virtue of you being on this call, you have some level of familiarity with what NAMI as a whole is. NAMI Texas is the NAMI state organization for Texas. We're a 501c3 founded by volunteers in 1984. We have our office at the Austin State Hospital, much like NAMI Central Texas does. We have 27 local NAMI affiliate organizations throughout the state, including NAMI Central Texas. And the number of NAMI members across the entire state totals up to about 1,600 members. So here is our agenda. This is what we're planning on covering. We're going to cover a lot of ground in a short period of time, and please do ask questions as they come to you in the Q&A box. We're going to, kind of cover the basics first, and then we'll get into some more specific actions that that people who are interested in engaging in this space can pursue. So we're going to kind of do the what, why, and the how, and then get into, more specifically the other things around the how in terms of what you can do as an interested party in the current legislative session. So first, what is advocacy? So advocacy comes from a Latin word. I won't try to pronounce the word, but that word in Latin means to call out for support. So there are a couple of good definitions of advocacy that I like to refer to. As you can see on the screen, one definition of advocacy is a tool for putting a problem on the agenda, providing a solution to that problem, and building support for activating on both the problem and the solution. Another definition of advocacy is a social change process affecting attitudes, social relationships, and power relations, which strengthens civil society and there's a couple little errors in the quote there, but opens up democracy. So, as you can see, advocacy is about identifying an issue, organizing around that issue, and proposing a solution, and then acting towards achieving that solution. And we'll talk about, I think when a lot of people think of advocacy, they think of something slightly different than, what I've just laid out. And we'll talk about the difference between kind of that form of advocacy and the form of advocacy that we're going to be talking about in this presentation. So we're talking in this presentation about policy advocacy, not personal advocacy. So when people hear advocacy, they'll often think of helping individuals navigate systems, helping someone sort of find the resources that they're looking for, or find a solution to their individual problem. That is personal advocacy. And we have nothing against personal advocacy. In fact, I think it's a very important thing, and people need someone who can help them find what they need, whatever resource it might be. It might be mental health care, it might be food, it might be housing. There need to be those kind of linkages. And interestingly enough, legislative offices, the offices that are in the state capitol, have a responsibility when it comes to personal advocacy. When they get calls from constituents looking for certain resources, those legislative offices are expected to help their constituents find those resources. That's in the Capitol, that's referred to as constituent services. But we're not really focusing on that kind of advocacy in this presentation. We're talking about policy advocacy. We're talking about identifying issues that affect groups of people, in this case, individuals affected by mental health conditions. And once we identify those issues, we're then identifying solutions to those issues that can be implemented on a broad scale. Macro level changes in government policy or in government funded or government run services, or statutes or rules or regulations that can, improve the quality of life for people affected by mental health conditions. And that is always our North Star. When we're looking at a policy proposal or an existing policy, does it or does it not improve quality of life for people affected by mental health conditions? And if it does improve quality of life, then we're pretty likely to act in support of it and advocate in support of it. So, the question comes up, like, why is this type of engagement so important? Like, why does it matter? And it's important because people with mental illness deserve the opportunity for recovery. And that is something, that we at NAMI view as a basic human right. And as a human right, it's something that we should be leaving no stone unturned in achieving. And you know, policy, laws, rules, regulations, those are certainly not the end all be all for, you know, giving a person the opportunity for recovery. There are, you know, nonprofit oriented services like ours. There are mutual, you know, support groups. There is, you know, ways that people can connect with each other in communities or on the internet. And those are things that can help a person achieve recovery. And they don't necessarily have anything to do with the government. But if there is an opportunity to improve, help a person, you know, improve their quality of life and experience recovery, then we should pursue it. And one of the ways of getting there, one of the ways of moving the ball forward to help more people achieve and experience recovery is through government action. And you know, government action on the cause of mental health has resulted in profound and significant improvements in quality of life. You know, I think of Dorothea Dix, you know, in the 1800s, advocating for psychiatric hospitals, advocating for those facilities to be built, because prior to that, people were suffering in squalid conditions. And, you know, the establishment of psychiatric facilities through government action created, you know, profound and significant improvements in quality of life. I think of the establishment in the 1960s of in infrastructure for community-based mental health services. You know, that was done through federal legislation signed by JFK, and then subsequently through state action to sort of actualize the vision that was put forth in that Community Mental Health Act of 1963. So, you know, the bottom line on this is, you know, if you can do it and it's going to make a positive difference, then you should do it. And the thing that, you know, you should do that I'm referring to is, you know, engage in advocacy for the purpose of helping improve quality of life for people affected by mental health conditions and facilitate recovery for those individuals. And it's important to remember, you know, recovery is possible and treatment works. And that's a message that we have to keep front and center. You know, there's a potential counter argument to the things that we're advocating for, that, you know, what is this investment going to achieve? What is this attention? What is this, you know, time that we invest in putting in place these mental health reforms? What is that going to achieve? It's going to help people achieve recovery. And we know that, you know, when you make that investment, more people experience recovery. One, because that's what the science shows, that's what the data shows. There is an exceedingly large body of evidence that shows that, you know, when people get access to the right care at the right time, they are much more likely to experience recovery and achieve a higher quality of life. And then secondly, we know, and this is alluded to on the slide, we know that treatment works and recovery is possible because we have so many powerful stories of people in our network and outside of our network who have made those gains by getting access to care. So that's why, you know, we know that this effort that we put into advocacy is worthwhile, is because we see more services being made available. And as a result of that, we see both anecdotally and in the data that more people are experiencing recovery and achieving a higher quality of life. While we know that treatment works, and we know that when people get access to it, they do better, not enough people are getting access to the right care at the right time. So there's a gap that exists between access and need. We need to be doing everything we can to close that gap, because access to care is a basic fundamental human right. just, these are just a couple data points, and data is important. The statistics like these are important. These are, statements of fact that we can link to studies that have been done. But as we'll talk about, data like this is really meant to support a different kind of argument about why mental health reform should be put in place. But it is important to, to look at this data and be able to say definitively that access isn't where it needs to be, and the need or the demand is considerably higher than the people's ability to access care. So, individuals waiting 8 to 10 years for mental health care, hundreds of Texans at this very moment waiting in jail for access to mental health services. Texas ranking, at the bottom of the barrel, just about in overall access to mental health care. These are circumstances that we should not be okay with, and that we should not just live with, roll over and accept. We have to do something about this. And because we are people whose lives have been affected by mental illness, we know that it's unacceptable for people to not get access to the mental health care that they need. And that may be because we or a family member were able to access care and it made all the difference, or maybe because we or a family member wasn't able to access care and it didn't make all the difference, and negative outcomes were achieved. Secondly, on the need piece, there's the overall prevalence of mental illness. It affects a lot of people. 1 in 5 adults, 1 in about 20 adults experiencing a serious mental illness. So there's, we have a rapidly growing state, population is up, and more people needing care means we need more access to care. And then just these really concerning stats around, how many suicides we have, how many educators have personally responded to a youth suicide. I was just looking at this data earlier today. We lose thousands of lives to suicide every year in Texas, thousands of people. And we need to do something significant to address that. And then COVID-19 is a big consideration here. These stats, these are the latest numbers from the CDC, indicate that, the mental health of Americans is very strained right now. The stats in terms of prevalence for anxiety and depression are 4 times pre-COVID data. So the demand is huge right now, and we need to do something about that. So why advocate? Well, it's really quite simple. If we're silent about something that matters, and I hope I've kind of made a strong case that this is an issue that really matters and that really needs to be a priority, addressing an issue like that has an impact on the well-being of Texans, is really critical. And if we don't do something about it, then we all suffer as a result. It's not just people who are directly affected; those who are indirectly affected also suffer the negative consequences if action isn't being taken. The least we can do on this issue is not be silent, and we can say something about it. But there's more than that we can do than just talk about it. We can act upon it, and we can advocate upon it. And government decisions have significant impacts. Budgets for mental health programs, government decisions affect insurance coverage, crisis services, services for people in the legal system, early intervention programming. These are things that matter to us as mental health advocates. I think it kind of goes without saying, and this is not an exhaustive list, and government decisions make an impact on these things that we care about. So we have to be engaged. So let's talk a little bit about how. Let's get into the how, and I think that's kind of what most of the rest of this presentation is focused on. So on this slide, these images that I put on the slide sort of portray the nitty-gritty, the nuts and bolts, the particular mechanisms of how one might advocate. The first one is the handshake, and that's meant to, portray the sort of traditional mechanism for advocacy, which in a lot of ways it ends up being going down to the Capitol and giving testimony, visiting offices, taking meetings, making the case face to face that a particular action should be taken on an issue. And as we'll talk about, actually going to the Capitol and doing those kind of activities around advocacy may very well be possible to a certain extent this current legislative session. However, I'm not predicting that there's going to be a whole lot of handshaking going on. If there was an elbow bump symbol or image or a little wave image, I would have put that in here. So probably not too much handshaking, but in-person advocacy is still on the table. However, we can also do a lot by phone, and we have a whole module of advocacy training that is focused on contacting your policymaker through phone, as you can see in the middle, or through email, through social media. That's the contacting your policymaker module of NAMI Smarts. So that's the nitty gritty, the nuts and bolts. But what more than that can we learn about the actual action that we're talking about when we're referring to advocacy or advocating? It's really the most important thing, in terms of what effective advocacy looks like and how you do it, is telling your story first, and then telling it well, or telling it effectively. I gave the facts and figures earlier, and those are important, but those are really supplementary to a compelling personal story. That includes, certain key elements. A story is much more likely to move a policymaker on an issue than facts and figures alone, and that there's research to support that claim. Any seasoned lobbyist at the Texas State Capitol will tell you that a rich, compelling, action-oriented personal story that has a clear narrative and a clear ask at the end of it it can be a total game changer for advocating on a bill. And you may have watched a hearing before. I've watched hearings where, someone who has a personal experience gets up there, someone who has been directly impacted by the issue, and they give their testimony, and you can see the elected officials sitting up there being visibly moved by the story that they just heard. And because of the story, they feel almost compelled to take a certain action on whatever bill they may be occurring. Lobbyists, do what they do. They, do a lot of the messaging as well. They give facts and figures. They may relate an anecdote from someone else and just kind of be the conduit for that anecdote being shared at the Capitol. But a personal story by someone who has actually been through that experience is the best form of advocacy and the most effective form of advocacy. And not just a personal story, again, just to underscore, a well-told, compelling personal story. So, what does a well-told, compelling personal story look like? Well, I'll just give you a few quick tips for how to do that. And this will come up again, but NAMI Smarts is a NAMI program that teaches these tips and then gives people the opportunity to actually write out their story and then practice their story and receive constructive feedback. There are various templates and worksheets that are helpful for people in crafting their stories. We'll talk a little bit more about that later, but let's just get to some of the key elements of that training program that, hopefully these tips will be useful for you. So the first tip is what I'll refer to as the pack-a-punch tip. You want your story to have impact. You want your story to move an elected official. You want it to uplift them. You you don't want to overwhelm them or give them too much detail. Tell them everything that's been going on. Tell them your entire story. You know, a lot of people have very long and detailed stories with all kinds of ebbs and flows and whatnot. There's just those sort of storytelling endeavors just tend to not really be well received. You want it to be short, to the point, and you want it to be moving and uplifting, and really you want to kind of try to end on a high note of, you know, here's how my life has improved, and here's how I've gotten better, or my loved one, here's how they've gotten better, and here's how they got there, and here's what you can do to facilitate that outcome for other people who have had similar experiences. So that's the pack-a-punch tip. The second tip is somewhat similar. This is the movie trailer tip. You want to keep the story brief. Aim for a minute or two. Leave them wanting more. That's what a movie trailer does for us. It hooks us. It piques our interest, and it helps us establish a connection with what we're seeing and hearing. It's the same thing with a short personal story, such as one that might be told in a testimony or on a phone call with an elected official. Short, you know, to the point, compelling and rich, and something that you can use to start to build a relationship and form an ongoing connection with the audience. But don't lose them by spending too much time or giving too many details. The third tip is around not overwhelming your audience with your emotions. The stories that we as mental health advocates might be telling can be tough, and they can be tough on the storyteller, and they can be tough on the audience. You know, I mean, let's face it, there are a lot of negative outcomes that we could talk about. And in some cases, a person's story really doesn't have that happy conclusion. It's just kind of a downer. And by having a story that follows that trajectory, that can be hard on us and can make us emotional as we go about attempting to share that story. And people will sometimes break down, you know, in the middle of their story. And there's no shame in that. And it's a very natural human thing, but it's not necessarily effective. We do want to use our emotions, but we don't want to overwhelm with our emotions. So, you know, it takes some practice a lot of the time. It takes, you know, some kind of honing of that ability to take a deep breath and refocus on our narrative, you know, rather than letting emotion overtake us. So, you know, a little tip would be focus on aspects of your story that don't bring up as much pain. You don't necessarily need to tell, you know, the darkest elements of your story to get the message across. And also using language that allows you to maintain composure, being intentional about your language choices so that, you know, you're not stumbling across words that are jarring for you to use or that make you emotional. And again, a lot of this comes down to practice. So this is the deep breath, eyes forward tip. The fourth tip, this is like a little bit of a hybrid. The heartstrings tip and the return on investment tip. So motivating with positive concepts like hope and recovery is important. You know, so it's sort of tugging at the heartstrings, but making them feel the seriousness, the gravity of the situation is important. But along the same lines, to an extent, is making them understand, making your audience understand that, you know, there is light at the end of the tunnel, that things can and do get better if people get access to what they need. So hope and recovery are powerful motivators. And to the extent possible, you want to use that to your advantage. If your story doesn't have those hopeful elements, talk about what would have been helpful to you or what would have been helpful to your loved one. And that way you can still get the message across that, you know, hope is out there and recovery is possible. We don't want to portray mental illness as intractable. We don't want them to get the message that, you know, people can't get better from mental illness, that it's just a never-ending, you know, downward spiral. It's not that. We know that as advocates. And so we don't want to send the wrong message there that, you know, the argument that the situation is just extremely dire and we need, you know, legislators to take really drastic action and, you know, everyone is suffering, that sort of language. Like we do want legislators to take action, but we're not going to get there by sending the message that, you know, the whole population of people with mental illness is suffering. Some are, but some are actually doing quite well. And it's important to make them understand that. And then stigma is a very real situation for us. And you know, the last thing we want to do is further the stigma of mental illness. You know, one of the things that I think contributes to successful advocacy is eliminating that stigma, so that we're erasing these notions that people cannot get better from mental illness, or that people with mental illness are violent, or, you know, any of those negative stereotypes or perceptions that people tend to have. We certainly don't want to make, you know, legislators believe in those things by using stigmatized language. We want to do the opposite of that, by using appropriate language and appropriate terminology. So we say persons with mental illness instead of the mentally ill, that sort of thing. It definitely works to our advantage. And then with regard to, I put ROI on the screen, return on investment. We want to make sure that legislators understand that that if they invest in services, that there are certain returns that they'll achieve when it comes to cost savings and other positive outcomes. Last tip, if you don't ask, you don't receive. You need to make a clear ask of your audience. This is good to state up front, to make clear what your purpose is, and then it's also good to underscore. It's critical to underscore at the end of your story. And this comes in the form of, can we count on you to take X action on this particular bill? That ask, if you don't ask, then they don't know how they can help. And the conversation that you just had with them doesn't have a clear resolution. Let them know how they can help, and make sure that they're aware of that. And then if they aren't committal, or you don't necessarily get the response you're looking for, don't take that personally. Just use it as an opportunity to build upon what you just planted the seed for. Okay, now for a little more of the nuts and bolts. There's a pretty good chance that if you're on this call, you live in or near Austin. So you can go to the Capitol. The Capitol is open. And well, there are some limitations, but there's a way of getting in and there's a way of advocating inside of the building. There's a visitor's parking garage at 12th and San Jacinto. There are some details about what the cost of using that parking garage is. And then I also recommend potentially looking at using public transportation to get down to the Capitol. That can make your life a lot easier, not having to worry about parking. About getting into the Capitol, you know, things are quite different in the COVID environment. So the Capitol currently is only open Monday to Friday, 9 a.m. to 6 p.m. You may only enter through the north door of the Capitol. We'll show a map on the screen in a second, so you can kind of get a feel for where that north door is. COVID testing is highly recommended and is easily accessible on the north plaza of the Capitol at no expense. Masks are required at all times inside the building, with some like limited exceptions for if you're providing testimony. But pretty much if you're going inside the Capitol, you can expect to have to wear a mask at virtually all times. And there are some capacity limitations that may come into play, and social distancing, with saying at least 6 feet apart while inside the building, that's a rule that is in place as well. And there may come a point where those capacity limits are actually necessary to ensure, that there aren't thousands of people inside the building. That can happen during a normal session. So they're going to do what it takes to prevent mass gatherings at the Capitol. At this point, I'm going to turn it over to Matthew to talk a little bit about the rules that have been established for engagement at the Capitol.
Thank you, Greg. As Greg alluded to, there will be some interesting logistical challenges this session. It seems that the COVID-19 pandemic is very much front of mind, though, so no worries. Precautions are being put in place. However, legislators must legislate, and advocates are an important part of that process. So it's important to review these rules for your own health and safety prior to making any attempt to go to the Capitol. But before I begin providing these rules, just a quick note that these rules have changed several times since session started, and they will likely change before February 12th, I believe, when everybody returns to the Capitol, which is like next Tuesday. So what I'm telling you today might not apply next week, so keep that in mind. However, these should be fairly consistent, although there probably will be some minor tweaks. So on the Senate side, it appears that testimony will have to be delivered in person. Unfortunately, you're going to have to go and present in person if you would like to speak about a particular issue. Utilize all these tips that Greg has provided you this evening. Will have to be done in person, on the Senate side at least. To gain admission to committee activities in the Senate gallery, the latest guidance is that visitors will have to wear a wristband that indicates a negative COVID-19 test. As Greg mentioned, those COVID-19 tests will be available at the front door at the north entrance. They say they're optional, but if you want to participate in any Senate-related activities, not so much optional. COVID-19 tests will be available at the north entrance, like I mentioned. If you hope to participate in the process in a meaningful way, then you're going to have to show up, go into the committee hearing rooms with your mask on. You can take it off, like Greg mentioned, while you're giving testimony, but then you'll have to put it back on and observe social distancing in the interim. The House rules, Greg, if you can go to the next slide, please. The House rules are pretty similar with a few exceptions. First, you will have to register. You will be able to register support remotely. So this is called dropping a card in the parlance. And on the Senate side, you will not be able to drop a card remotely. You will have to be connected to the Capitol Wi-Fi in order to register support. This is different than providing testimony where you speak. Dropping a card is where you just go and say, hey, I'm supportive of this, and it shows up in the public record. On the House side, you will be able to do that from your home. To register, second, on the House side, invited testimony will be able to be delivered remotely. However, the opportunities to provide invited testimony will probably be very slim. NAMI Texas may not even have the opportunity to deliver invited testimony. So for the most part, if you wish to deliver testimony on the House side, it will likely have to be in person as well. The next piece, I guess, is for office visits. And the Senate, the House and Senate sides are pretty consistent and the same in that policymakers will be able to determine the rules for office visits themselves. Some, like Senator Eckhart here in Central Texas, is requesting people not come visit them in the office. You can set up a Zoom virtually, but they would like you to keep your distance. However, on the other offices in the Senate side are welcoming people into the office, and they're not requiring as extensive safety precautions. So I was on a call with an office last week, and the extent of their safety precautions were hand sanitizer. So be aware of which representatives or senators you're going to see, because they may have different kind of expectations about the level of precautions that you should take when trying to engage them in conversation or in your advocacy efforts. Next slide.
I'll talk a little bit about this. This is just so folks have a basic understanding of what the Capitol grounds look like and how to access the building. So the visitors garage is over here on the right hand side, 12th and San Jacinto. the entrance to the Capitol is up here on the north side by 15th Street. That's the only entrance that's open at this point in time, is the north entrance. So now you made it into the Capitol, and you've entered on the first floor on the north wing. You're likely going to the Capitol. If you're there, you're probably going for a hearing, either to give testimony or to register your position. It looks like nearly all of the hearings this session will be in the extension part of the building. So let's focus on getting down to the extension. So the extension is 2 floors below where you entered the Capitol on 1 North. So you can either take the elevator on the north wing of the Capitol first floor, you can take that down to the extension, and there are 2 floors of the extension, E1, and then below that, E2. Or if you're not wanting to get in an elevator, you can take the stairs. The stairs are located very close to that north wing of the Capitol on the first floor. So you'll take the stairs down to the ground floor, and once you get to the ground floor, I will show you on an upcoming map how you get to the extension. So the ground floor is the bottom map here. So you've come down the stairs from the first floor. You're by the center rotunda. This is not the iconic rotunda where you look up at the ceiling and you see that Texas star all the way at the top of the dome. That rotunda is on the first floor, but directly below that iconic first floor rotunda is the ground floor one. You want to walk up to the north wing from there to the ground floor north wing, and then just keep walking straight, and you'll find yourself in the beautiful shiny extension, the much newer part of the Capitol, arguably the more interesting where more of the action takes place, let's just say. Also, the cafeteria is there, which is definitely one of my 3 favorite rooms in the Capitol. So you've made it to the extension, and this is an important part of the Capitol. This is probably where you're going to be doing most of your advocacy. So you want to be part of a hearing that is taking place in the extension. You've looked up ahead of time which room number that hearing is going to be in. Probably the easiest way to find that out would be if NAMI Texas has alerted you to the room number for the hearing, or you've gone on Texas Legislature online and gone to the House hearings webpage or the Senate hearings webpage, and right on there will be a room listed for the hearing that you're interested in going to. So Matthew kind of already covered this stuff in terms of how to register a position in the House versus how to do it in the Senate. I think a good summary would be in the Senate, it appears you are pretty much going to have to be on Capitol grounds to either register to testify or just register your position. Like I am, John Q. citizen, and my position is support on X bill. You're going to have to be on Capitol grounds to do that in the Senate, it appears. In the House, it's a little different. This session, you may be able to register a position off Capitol grounds. We'll talk about how to do that. You may be able to submit written testimony remotely, but you can only do remote verbal testimony if you've been invited, is what that should say. If you've been invited, you can do remote verbal testimony. You may use your own device to register to testify. There's a website that you can go to for that, whereas in the Senate, you have to use one of the Senate kiosks, which are little iPads that they have set up mostly around the extension. So these are the maps for the 2 floors of the extension. So you've entered at the bottom of the page here from the ground floor, from the elevators. And then the kiosks are located where you see the little blue shading. So the main hallway is in the center here on both floors. And then the hearing rooms line the main hallway. Behind those hearing rooms where you see the blue shading is where you're most likely to find the little iPad kiosks to register to testify or register your position on a bill. Here's what the iPad kiosks look like. I have a few slides here on like the different steps once you approach a kiosk, the different screens that you'll be asked to fill out. I'll move through those pretty quickly. It's pretty self-explanatory. You just kind of follow the steps. So you first walk up to the kiosk, maybe want to use some hand sanitizer before you step up, and then first screen, hit the begin button on the bottom right. Select the hearing that you're there to be involved with, whether it's testifying or register a position. Hit select next to that hearing. Might be the House Committee on Public Health or the Senate Committee on Criminal Justice if you're going to a Senate hearing. Hit the select button. Select the bill that you're engaging in, whether it's testifying or registering a position. You can do multiple bills at the same time. It's pretty likely you might be there for more than one bill on any given day. Click those buttons, and then for the bill that you're registering a position on, you have to indicate a position. For means you support, against means you're against it, and neutral means you're not quite sure, but there are likely some changes that you'd like to see made to the bill, and that would be necessary in order for your position to go up to a for or support position. And then you indicate if you plan to testify or not. So if you just want to register your position, but you don't want to give a short speech in support of the bill, you hit not testify. But if you want to say your piece in 2 or 3 minutes, you hit testify and then hit OK. Who do you represent? People can get a little thrown off by this. There's 2 questions on the screen that you're asked to fill out. Enter the group, organization, agency, or governmental entity name. If you're a member of NAMI Central Texas, or you want to associate with NAMI Texas or another affiliate, write out the name of that organization. I usually put National Alliance on Mental Illness, parentheses, NAMI Texas. And then the question, do you also represent yourself as a private individual? Most people like to answer this question, yes, because they're not only representing an organization as a volunteer, but they're also representing themselves as an advocate. And they're likely going to be sharing their personal experiences, their personal story. So a lot of people will select yes, and then enter into the box where it asks you to enter your occupation or profession. You can really put whatever you want there. A lot of people will put advocate or volunteer or retired or student. It's up to you. And then you hit the next button. Oops, there we go. And then you enter your contact information. And you can either fill these boxes out every time you go, or you can load your previously saved contact information. There's a way to create an account so that these boxes auto-populate every time you go, and you don't have to type into them each time. That makes it a little more efficient. Basic contact information, you hit next, and then you acknowledge that everything you put into the witness registration form is true and accurate, and you check the box for that, and you finish. And now you're in the system, and the committee that you just registered a position in or registered to testify in knows who you are, and they know that you're interested in making your voice heard. So just a couple quick tips. Arrive before the scheduled time of your hearing. You know, if it's an 8 o'clock hearing, don't get there at 9, because there's a pretty good chance they'll have already covered the bill that you wanted to address. Similarly, in a way, is if it's a 1:30 p.m. hearing, you know, there's really no point in getting there at 7:30 a.m. And you may actually end up wasting time, because the 1:30 p.m. hearing may not even be posted to the witness registration system yet. I mentioned the piece about creating your public profile in advance. If you don't have time to wait around and testify, you can register your position by using one of the kiosks. And then some of the committees don't use the iPad kiosks. In those committees, you go to the hearing room and you fill out a little paper card that has all the same information as the kiosk. And for the Austin area advocates, this is a great thing to do. Like, you may not want to spend all day there waiting for your turn to testify, but you can go to the Capitol, register in support of bills that you support or that NAMI supports, and that is a way of showing strength in numbers, that there are a lot of people who support or oppose a particular initiative. If you're giving testimony, much of what I said around storytelling at the beginning of this presentation applies to the experience of giving testimony, but just for a couple of little more practical tips, be in the hearing room when the committee is hearing bills. You don't know which order they're going to take the bills up in. So be there, because they might call your bill up without any warning, and you might be the first person who registered to testify. And if you're not there when they said your name, you might have just missed your chance to testify. The committee is unlikely to take testimony if either the House or the Senate are in session. So it's good to know if the full House and the full Senate are in session. When they adjourn from full session, which in some cases is late in the day, they will often resume the hearings that they started early in the morning before they went into session. So you know that if they're in session, you're probably not going to be testifying then. But adjournment is when you might find yourself heading back to the hearing room to give your testimony. You wait for them to call your name. Limit your comments to 3 minutes. In other cases, it might be 2 minutes. So they usually have you on a timer. It'll beep when you have 1 minute left. Some of the committees have a little light system where if the light turns yellow, you have a minute left. And then, when it turns red and it might make a buzzing sound, then it's really time to make your last point, say your last sentence, and end your testimony. And then the NAMI Smarts class. If you've taken NAMI Smarts, be sure to use what you learned there. Matthew will talk about our NAMI Texas Days of Action.
Yeah, so if you guys are a little bit reluctant to go up to the Capitol because of COVID-19, of course, there are options still. NAMI Texas is hosting a series of virtual legislative outreach sessions. The first day of action was this past Friday. It was a huge success by every measure. We had 80 people register. 73 of them, we were able to secure legislative outreach meetings for 73 of them. Roughly 60 people were able to make those meetings and participated, and they spoke with 23 local legislators over the course of the day. So it was, like I said, it was a huge success. So if you want to participate in the next day of action, the next one is happening the last Friday in February. There are also days of action the last Friday of March and April as well. But the next one is Friday, February 26th. Registration is currently open. However, registration closes a week from today at 5 p.m. on the 11th. After registration closes, we will go about the business of scheduling those appointments, and then we'll provide you updates, a bunch of information on what you can talk about with your legislature. We'll provide you with a sample script, and we'll connect you with other people, other constituents, and you'll be able to put those NAMI Smart skills into action and assigning roles, talking about talking points or identifying talking points, and really delivering an excellent testimony or excellent outreach to your local policymakers, hopefully on behalf of some particular issue, which we will also give you suggestions upon. Next. So this brings a nice bridge into our policy platform. If you are new to the policy advocacy world, NAMI Texas has got your back. We have developed, I think there are approximately 40 positions in our public policy platform that cover a variety of topics or issue topics. Those are listed here. I don't want to take up too much time because I know we are running close to the end of this presentation, but you're more than welcome to check out those policy positions on the NAMI Texas website, namitexas.org, under the advocacy page. You'll be able to access that full platform and see everything that we advocate for and on behalf of our membership. Next slide. Okay, so if you want to stay abreast of advocacy updates, so there's more that you can do besides just participating in the NAMI Texas Days of Action. We provide opportunities, or we provide information about testimony you can deliver to like agency subcommittees. So the Behavioral Health Advisory Committee, for example, there are opportunities to provide public testimony to that committee. And you can find information about how to do that in our advocacy newsletter. We suggest that you register for it. Yes, Christina has dropped the link in the comments box. That way you can stay abreast of any advocacy opportunities and also what NAMI Texas is doing at the Capitol. Greg already mentioned NAMI Smarts. This is our hands-on advocacy training. We don't have any NAMI Smarts trainings scheduled in the near future. However, if you do sign up for the newsletter, we will keep you posted on when those trainings do become available. You can also participate if you are a NAMI Central Texas member and their advocacy committee. We suggest you reach out to NAMI Central Texas to see how you can participate. And of course, stay on top of social media, because that's where we post a lot of our legislative happenings, what's going on around the Capitol, and new bills that are interesting and relevant to mental health policy.
I wanted to make sure you see that Greg and Matthew's contact information is all there, and I will agree, because I do follow you on social media, that is a great place to stay in touch and kind of keep abreast of what's going on. I did want to make sure we had one question that did come through, and I thought it was a really great one. Statistics like those shown are very important, and we communicate the need in our communities. So the question was, what are some good data sources for mental health care and mental health needs in the state of Texas? So as individuals, if we want to, access some of that data, and then I may have missed it, but I did want to, usually we are able to share the PowerPoint with folks that are watching in our follow-up email. Would you be able to provide a PDF of that as well, so we can share that? You had so much information in your PowerPoint.
Yeah, I'd absolutely be glad to share the PowerPoint.
Great.
As far as the question of good data sources around mental health in the state of Texas, there are a few really good resources for that. My opinion is that the best one is the Hogg Foundation for Mental Health's Guide to Mental Health Systems and Services in Texas. And that's got a little bit of everything, all kinds of really useful data points and charts and infographics. It basically explains the Texas mental health system in a very readable, digestible, understandable way. So that is probably the best one that I would recommend. Also on the NAMI Texas website, in the advocacy section, and in the research section, you'll find some good resources there as well.
Okay, great. And that's a pretty hefty manual, if I recall. And so is that available online? Like you can just access it online, is that right?
Yeah, the whole thing is available online for free.
Great. Okay. Well, thank you so much, both of you, for being just this wealth of information. And we're so grateful for you and all the work that you do in ensuring that our voices are heard and helping to educate us on how to be better advocates. We really do appreciate you. And as you both mentioned, NAMI Central Texas, for those of you that are in the Central Texas area, is your affiliate to also, we do have an advocacy committee. You're welcome to join us as well. We're constantly educating ourselves and learning from each other. So I think so often what keeps people from serving in that role is they feel like they don't know enough. And so I love that you mentioned the power of telling your story in a really effective way. And that's part of, I think, when you gather with other advocates, builds your confidence in that. So as we move into this, continue to move into this legislative session, again, we're thankful for you. We're thankful for all of you who joined us this evening. We'll be back on February 18th at 11 o'clock to talk about how to make sure that we finish the race on this pandemic that we've all been navigating. So make sure you come back and join us then. Thanks so much, and have a good evening, everyone.